Patients often complain about long wait times or scheduling mishaps, and this leads to frustration both for them and your staff. Efficient appointment management can drastically reduce no-shows and improve overall satisfaction. In this video, let's explore strategies to streamline patient scheduling and boost your practice's efficiency. I'm Dr. Ariana Demers, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. Let's talk about improving patient scheduling to boost your practice's efficiency and satisfaction. We'll explore using online scheduling tools, educating staff and patients, managing your patient waiting list, and implementing reminder systems. Plus, we'll weigh in on the pros and cons of charging a no-show fee to keep your operations smooth and your revenue steady. So I always get this question, how can I improve patient scheduling to make my office more efficient? So how can we improve this scheduling? Whether you're a medical practitioner or a healthcare provider, efficient scheduling can dramatically enhance your practice's efficiency as well as patient satisfaction. So first tip is using a scheduling tool. This allows patients to schedule appointments through your online portal or app. This definitely, and I know from myself, this increases your patient satisfaction by making it more convenient. And it frees up your staff time to spend time on direct patient care. This is more efficient and you can provide better care. So ultimately, you also need to educate your staff about appointment scheduling. Educating staff about appointment scheduling is important for efficient practice management. This involves training them on the various appointment types and the respective availability of those appointments. So staff should be able to prioritize all of the appointments effectively and know when urgent cases and how to handle them versus routine visits to schedule these appropriately. Also, educate your staff on what patients take priority for the growth and revenue of your practice. Next, educate your patients on how to be efficient in your practice, how you interact with them. So give them clear instructions for appointment preparation, expectations, and empower your patients to reduce delays and optimize your visit efficiency. This also allows for optimal pre-framing, so they are already ready to consume what you have to offer. So really, effective communication is super important for positive patient experience, while also streamlining your process in your office. Patient waiting list is one thing that we've implemented. Last minute cancellations can be frustrating, but having a waiting list really helps you manage these situations efficiently. Using a scheduling platform that with a built-in waitlist feature allows you to notify your patients quickly of new available times. This approach saves time and maintains revenue, freeing up more of your staff time to focus on the productive tasks like patient engagement and other important streamlining tasks. The appointment reminder system can give you either automated systems with calls or texts, and that also decreases the no-show. Also, we have implemented a rescheduling link to be able to reschedule with this reminder text. But sometimes a personal reach out is also important to connect with the patient and reschedule if needed. So this also brings me to this cancellation policy. And you can educate them if there's fees or, decreasing that risk of no-show. So this discussion of should you charge a no-show fee? So this is a tricky question I get a lot. Should you charge a no-show fee in your practice? And honestly, I have feelings both ways. So here's some key considerations to help you decide if a no-show fee is appropriate for your practice. So The pros of a no-show fee is you cover your costs, right? By charging a no-show fee for missed appointments, you can recoup the expenses for staff, rent, utilities, and other services that were already prepared for that time slot. When a client doesn't show up, it really affects the overall environment and efficiency of your practice because the resources and space were reserved for them. Typically, this is an industry standard, and implementing a no-show fee is common practice, where this is pretty normal. Additionally, you want to be able to be compensated for your time and effort. You've already prepared for these visits, and you're ready for them. They just no-showed. This prevents lost revenue from a time-based appointment. And if you don't have a fee, you're going to miss out on that income from another client that could have taken that slot. Additionally, by charging for missed appointments, you emphasize to your patients that your time is valuable and your services have a cost. Patients also increase their commitment if they know there is a potential financial penalty for missing the appointment. So establishing a missed appointment fee policy is really good practice. You maintain clear and professional guidelines as to how to interact with your practice, and you can improve your overall management of your practice. So the cons: you may lose regular patients who sometimes miss appointments. You also penalize for genuine emergencies. So charging a fee might be unfair. And so this for us has been this conundrum. Additionally, if you charge a no-show fee for clients or patients who have some unexpected financial issues, this is really a little bit harsh since you don't really know their full situation. So really, really important, regardless if you choose to have a no-show policy, a fee or not, there is a good need for flexibility. Offering flexibility like waiving a fee for first-time no-shows or unique situations, and make this really clear so there's no surprise when a fee shows up on their charge. Additionally, considering your practice's costs and the value of your time when deciding this no-show or late cancellation fee, it's really important to set clear boundaries, but be flexible and be human and allow for mishaps. So, improving patient scheduling promotes more efficient and satisfying practice culture. So sometimes patient scheduling can be your downfall or your savior. What I mean by this is if you manage your schedule effectively and prioritize those patients who fall within your ideal patient avatar or fall within the scheduling type of patient that is in line with your goals and what you are providing as your core offer, that's really important. So really going through and making sure that the schedule reflects your values and who you are serving is really important. And this will allow for really nice, streamlined, relaxed, but efficient ways and days in your clinic. So we have instituted a waitlist. You can use a scheduling tool or other waitlist feature on your scheduling tool. But really importantly, things come up. And the thing about the waitlist is people are ecstatic. When we call them and say, hey, you're on our waitlist, we've had a cancellation, and we'd like to offer this to you tomorrow. They're excited and ecstatic. And this allows us a little bit more touch before the appointment to pre-frame so that they know what's going to happen in the appointment, what we're looking for, what our services are, so that when they come in, they are ready and all they have to say is, yes, I want that. And that is great for everybody. They feel like they got their needs met. We feel like we got our needs met, and everybody is happy and they're impressed that our office is so responsive, and that when we said we put them on the wait list, that actually happened. And so that increases trust as well. And so they come in a mindset like, wow, this clinic really has their act together. They said they're doing what they said they're going to do, and I was able to get in sooner. How great. So that is really important for us. We do not have a no-show policy because we've so effectively used our wait list that we know that we're going to fill that slot regardless. So we don't have spaces in our day. Even if we have a no-show, we have this really, really aggressive wait list that we can fill that day patients that may or may not no-show. The other thing that we do is if they are not there within 1 minute of our scheduled appointment, we call them and check in. Because if that is an issue that we're having and they're not there, sometimes what we can do is just transition their appointment to a telephone or video conference appointment on the fly. And that also helps decrease your no-show rate so that you don't have to change or charge them a no-show fee. And that gets them seen, gets you paid, gets their needs met, and everybody's happy. So that's kind of our way that we've addressed this issue of scheduling, and it's been really, really effective. The more you troubleshoot on the front end, the happier you're going to be on the back end, and you're going to have all those patients that you want to see and they want to see you. I believe that no-shows are directly related to how effective you have been at pre-educating your patient. Because if they know what the appointment is for, what they're going to get done, what questions they're going to have answered, and how to move forward, and that they know they already want what you're selling. They already want your product and they think it's valuable, and they just show up and be like, yeah, I want that. That is the most successful appointment, and it takes the least amount of in-person time. So if you pre-educate, they already know this appointment's right for them, they know what they're going to get, and they just want to say yes. Whereas if they're calling and they're like, gosh, I've been waiting for this appointment. I thought you were going to solve every single one of my problems, and now they're disappointed and you didn't measure up to their expectations. Well, that is a problem of you doing a bad job or an ineffective job at pre-framing, pre-educating on what those expectations are gonna be. Like, how does your appointment go? So I 100% agree that effective pre-education is gonna be the most important thing to have great, seamless appointments to confirm that they wanna move forward with you in the future. We've discussed using online scheduling tools, educating your staff and your patients, managing a waitlist, which is my favorite way to decrease no-shows, and then implementing this reminder system with the ability to reschedule. We've also covered those pros and cons of a no-show fee to help you make decisions to streamline your operations and boost your productivity. So now that you've streamlined your patient scheduling, let's focus on expanding your client base. So join us in the upcoming video to learn effective ways to get referrals from other physicians and healthcare practitioners. And please don't forget to subscribe to our newsletter for the latest updates and news about us.